My name is Joe Shmalo, originally from Sarasota, Florida. Well, we came back from a trip overseas. We was in Israel, and after the first day home, I was just feeling blah and stayed home all day. The next morning I got up and I just wasn't feeling good. I called my physician, Dr. Baker, and or my wife did, and he, on the phone, I heard the secretary or the receptionist say 2:30, and I said, no, I gotta get in now. So we got in at about 9 o'clock, and his nurse, Deborah, which is wonderful, took my blood pressure, and that was it. She got Dr. Baker, took me over to the emergency room, and after that, I don't remember, I was in mission. If you have any kind of a problem whatsoever, they can get you to the finest, one of the finest hospitals in the country in 12 minutes. You know, if you're in Atlanta or my town of Sarasota, I'd probably still be in the waiting room. They did a triple bypass, and I was there 5 days getting my blood pressure up, and then they did my surgery, and I was there 4 days afterwards, and the hospital is unbelievable. I had nurses that came in when they weren't even my nurses when it was on their shift to see me. That means they care. If they come in and see how you're feeling, and they're not even your nurse for the day, they're taking their time to check on you, and I'm sure I'm not the only patient they checked on. That means they're not there for a paycheck, they're there because they want to help you. And I think that's really what mission's about, or the whole system is that way. They know me by name. When we got home, that's all you have to do is call the hospital, immediately answers, and within a minute, you have a physician's assistant. You don't have the doctors, but you have their assistant. You tell them what's your problem or what's going on. Within 5 minutes to 10 minutes, maximum, we only had to call a couple times, Dr. Ely called me. He personally called me back on 2 little small issues I had. To me, I don't know how you can ask for much better care than that. There is a couple gyms in town, you know, where you can go to personal fitness training, but what you get at the health tracks is completely different. These are people who take your blood pressure, they monitor you, they care. I changed my diet, you know, with Yvonne and my cardiologist, mostly Yvonne, to be honest, gave me a booklet, told me what to eat, showed me what to eat. I bring things to her that looks great to me. Then she'll tell me, read the label a little closer, and it's in there, it's trans fat, or, you know. It's just a wonderful staff we have in Health Tracks. But I think I'm the only patient over there that's on no heart medication, no medication. And I'm only 7 months out of surgery. Nothing, I am on no medication. If I knew how I was gonna feel today, I wished I would have had my heart attack 10 years ago. And serious. It took a few months to get going, but if you stay with the program, you feel better than you did at 50. I actually think I feel better now than I did at 50 years old.